5 types of extrapyramidal symptoms are there. The first, acute muscle dystonia, drug-induced Parkinsonism. The third extrapyramidal symptom is akathisia. Now, in patients who have come to you with akathisia, this side effect will appear after 4 months, and the patient is presented to you with inner restlessness. So, patient will come to you with inner restlessness, where the drug of choice is propranolol. So, propranolol is the best medicine for inner restlessness, which is also known as akathisia. The fourth side effect is tardive dyskinesia. The fourth side effect is tardive dyskinesia, where we discuss that patient will have rabbit-like facial muscles contraction. So just like a rabbit, patient will have abnormal orofacial muscle contractions. So we also call it rabbit syndrome. So in tardive dyskinesia, patient will have abnormal contractions of orofacial muscles. We call it rabbit syndrome. And we discussed already in topic of ANS, whenever the patient of rabbit syndrome will come to you, it's a kind of a hyperkinetic body movements. Patient will have dyskinesia. Dyskinesia means abnormal body movements, the painful body movements along with this rabbit-like symptoms. So we have to stabilize the patient with dopamine depleters. We have to stabilize the patient with dopamine depleters. So if key on TV, chori chori, we will see a channel where the logo is rabbit, right? So we'll chori chori, that is Korea. We see a channel, we will watch a channel where the logo is rabbit, right? So tardive dyskinesia, the best treatment is tetrabenazine, venlafaxine, dopamine depleters. We made a mnemonic that on TV, chori chori, we will watch a channel with the rabbit logo. So chori means Korea, rabbit means the rabbit syndrome. It's a tardive dyskinesia. We use tetrabenazine and venlafaxine for that. Now once the patient gets stabilized, once you control this rabbit syndrome, we start clozapine in this patient. This is how we manage this rabbit syndrome. The fifth one is malignant hyperthermia. So malignant hyperthermia, patient will develop everything in exaggerated mood. So all cells of the body, all centers of the body will be stimulated. So patient will have tachypnea, patient will have tachycardia, patient will have high blood pressure, hyperthermia, hyperkalemia, seizures. So each and everything is stimulated. And drug of choice is same as for malignant hyperthermia, which you people must have covered in anesthesia class, dantrolene sodium. Right? And for the first two extrapyramidal symptom, that is acute muscle dystonia and drug-induced Parkinsonism, we have covered this medicine in topic of ANS, that is benzhexol. So benzhexol is the best medicine. It's a muscarinic 1 blocker. We discussed on mnemonic. If you have Mercedes-Benz, then you don't have to think about the parking. So this Parkinson's like symptoms will be controlled by benzhexol. Second drug of choice is promethazine. This is what we have discussed for extrapyramidal symptoms. Now apart from these extrapyramidal symptoms, we discussed some unique side effects. So these are the common side effects of antipsychotics. There are some unique side effects of antipsychotic medicine. So we discussed that quetiapine. Quetiapine is a medicine which can cause cataract as a side effect. Quetiapine can cause cataract as a side effect. And there is a drug clozapine. Clozapine is a drug which can cause agranulocytosis. Clozapine is a drug which can cause agranulocytosis as a side effect. Now again this word is agra. Two medicines will start with what? Car. Right? So car, that is carbamazepine. The second was carbimazole. If you remember, carbamazepine is an anti-epileptic. Carbimazole is a drug of choice for Graves' disease. And this is clozapine. So clozapine is antipsychotic medicine. So please remember, in closed car, we too will go to the agra. Right? So in a closed car, we two means two cars hai yahan pe. So in a closed car, clozapine, car means carbimazole, carbamazepine, we will go to the agra. So agranulocytosis, side effect of 3 medicine, and all 3 medicines starts with alphabet C. So car, close, agra. This medicine will also cause myocarditis, right? So clozapine can also cause one more unique side effect of myocarditis. Right? So clozapine will be asked in your exam. It's a drug of choice for refractory cases of schizophrenia, as well as it's a drug of choice for suicidal tendency in psychosis. So wonderful drug, clozapine, right? All side effects are maximum with clozapine except D2 blocking side effect and QT prolongation side effect, right? And all side effects are minimum with aripiprazole. So that's all about antipsychotic, which we have covered. Now after antipsychotics, we talk about depression. So other aspect of psychiatry is neurosis. Other aspect of psychiatry is neurosis. So patient can have neurotic disorder. So neurotic disorder is due to the deficiency of serotonin, and sometimes it's due to the deficiency of noradrenaline. We discussed that the psychosis is due to the excess of dopamine and serotonin, but neurosis is due to the deficiency of serotonin and noradrenaline, right? And the disease are depression. So patient can have depression, patient can have depressive disorder, patient can have anxiety disorder, patient can have depressive disorder, patient can have anxiety disorder, or patient can have body dysmorphic disorder. So there are three disorders which can occur as a result of neurosis. Three disorders which can occur as a result of neurosis. One is known as depression, the other is known as anxiety, depression, anxiety, and body dysmorphic disorder. Body dysmorphic disorder. Now for the treatment of these kind of disorder, anxiety means the different types of anxiety disorders, like so treatment of OCD, phobia, right, panic disorder, bulimia nervosa, all these are anxiety disorder. So the medicines which we use for neurosis are known as antidepressants. The drugs are known as antidepressant drugs. So the medicines which we use for neurosis, we call them antidepressant medicines. Now antidepressant drugs can be of two types. Now these drugs can be typical antidepressants or can be atypical antidepressants. So antidepressants are typical antidepressants or atypical antidepressants. Now typical antidepressants are the medicines, examples of these medicines are SSRIs. Number 2 group is SNRI. Number 3 group is tricyclic antidepressants, and the fourth is MAO inhibitors. So typical antidepressant medicines are SSRIs, SNRI, tricyclic antidepressants, and MAO inhibitors. 4 group of medicines are there. Now out of these 4, MAO inhibitors are outdated. So this is unimportant topic for your exam. So we did not discuss these medicines much in detail during our lecture. So typical drugs are only 3 for you people: SSRIs, SNRIs, and TCA. Right? Now what is the difference between SSRIs, SNRIs, and TCA drugs? So that difference is given in this table. So medicines are SSRIs, SNRIs, and TCA. 3 medicines are there. Now SSRI full form is selective serotonin reuptake inhibitors. Typical antidepressants, 3 medicines we are going to discuss together. SSRIs, selective serotonin reuptake inhibitors. So whenever you give the medicines, only serotonin level will increase. That is typically required. That is typically required for the treatment of depression or anxiety disorders. Now what are the drugs which we use under this group of SSRIs? Now we have a mnemonic for this to remember the drug name. So SSRI's drug name mnemonic is flu paracetamol se escape hoga. So flu means fluoxetine. So mnemonic hai, it's a Hindi mnemonic actually. One student sent me this mnemonic. I am really thankful to that student who sent me this mnemonic. I don't know his name actually. So mnemonic is flu paracetamol se escape hoga. So flu means fluoxetine. So flu means fluoxetine and fluvoxamine. So flu means fluoxetine and fluvoxamine. So flu paracetamol se. So paracetamol means paroxetine. Se means sertraline. So flu paracetamol se escape hoga. Escape stands for one more drug which is missing over here. The drug name is escitalopram. The drug name is escitalopram. So drug name is escitalopram, which belongs to this class. So drug name is escitalopram. So escape means escitalopram here. So flu, fluoxetine, fluvoxamine, paracetamol se, that is paroxetine, sertraline, escape hoga. Escape means escitalopram. So these are the drugs which are SSRI. Now please remember, these days SSRIs are drug of choice for all type of neurotic disorder. So we discussed there are 3 types of neurotic disorder, like depression, anxiety disorder, body dysmorphic disorder. So these medicines are drug of choice for all type of anxiety disorder like depression, anxiety, and body dysmorphic disorder. Apart from that, these medicines are given for problem of one young female, that is premenstrual symptom, and also given for problem of old females who have mood problems or mood disorders in menopausal state. So old females who have mood problem in menopausal state, we use SSRIs. So one problem of young female, PMS. PMS stands for premenstrual symptom, and old female problem, menopausal symptoms, we use this medicine. So they are the best medicine for all type of neurotic disorder, depression, anxiety disorder, body dysmorphic disorder, premenstrual symptom, and one problem of old female, menopausal. Now they are also drug of choice for one problem of male patient, that is premature ejaculation. So these medicines are best medicines for premature ejaculation, right? Now, whenever we give SSRIs, please remember SSRIs are very safe medicines to be used clinically. But there is one drug over here which is unsafe, that is paroxetine. Now, paroxetine is a drug which is unsafe, should not be given to a pregnant female. But please remember, paroxetine is a drug of choice for premature ejaculation, which we discussed above. So we made a mnemonic during our lecture discussion. This paroxetine is a drug that is given for penis problem. So P stands for paroxetine, P stands for penis problem. So paroxetine is the best medicine for penis problem, that is premature ejaculation. But once the female is pregnant, this penis wala drug is contraindicated, obviously, right? So paroxetine starts with P, it's given for penis problem, that is premature ejaculation. But once the female is pregnant, this P wala drug or penis wala drug is contraindicated in pregnancy. Now, what are the side effects of SSRIs? Now, please remember, side effects of SSRIs, the most common side effect of SSRI is GAT side effect. So, GAT side effects are the most common side effect. The medicines will cause nausea, vomiting, and diarrhea. Number two, these medicines can cause serotonin syndrome. So, medicines can increase the level of serotonin. So, medicines can cause serotonin syndrome, and these medicines can also result in sexual dysfunction. So, sexual dysfunction in sense of delayed ejaculation. So these medicines can cause delayed ejaculation or delayed orgasm. So we also call this side effect as anorgasmia, right? So medicines will cause anorgasmia. So patient ko orgasm will be delayed. So medicines are given for premature ejaculation. So three very important side effects are nausea, vomiting, and diarrhea. Most common side effect, serotonin syndrome is one of the rare side effect. Sexual dysfunction is also very, very commonly seen with SSRIs. Now there are two SSRIs which are short-acting SSRIs. Please remember, all SSRIs are long-acting. All SSRI drugs are long-acting medicines, but there are two short-acting SSRIs, and these two SSRIs are paroxetine and fluvoxamine. Right? So please remember, जो paroxetine है, that is given for premature ejaculation, given for penis problem. So paroxetine given for penis problem, this drug is short-acting medicine. Obviously, when you get involved in intercourse, you don't require a drug that acts for long, right? So because intercourse is a process that lasts mainly for half an hour, mainly for maximum 1 hour, not beyond that. Don't require a medicine that acts for 1 week, right? So paroxetine is a drug that is having the short action. This is a short-acting medicine. दूसरा है fluvoxamine. So paroxetine, fluvoxamine are two medicines which have short action. So a patient skip the dose of this medicine. A patient will skip the dose of any of these medicine. Patient can develop all symptoms of anxiety back. So patient can get all symptoms of anxiety and depression back. This is known as discontinuation syndrome, right? So this is all about SSRI. What we have discussed? We have discussed that SSRIs will increase the level of serotonin when given to a patient. Increase the level of serotonin when given to a patient. Medicines names mnemonic is flu paracetamol से escape होगा. So flu means fluoxetine, fluvoxamine. Paracetamol means paroxetine. Se means sertraline. Escape means escitalopram. These medicines are drug of choice for all type of neurotic disorder like depression, anxiety disorder, body dysmorphic disorder. Apart from that, they are given for one young female problem, premenstrual symptoms, given for one old female problem, that is menopausal symptoms, and also given to one male problem, that is premature ejaculation. The drug was paroxetine. Now paroxetine, which is given for premature ejaculation, is contraindicated in pregnancy. So we discussed that the drug which is given for penis problem should not be used during pregnancy. Most common side effect is nausea, vomiting, diarrhea. Rare side effect is serotonin syndrome, and sexual dysfunction is one of the common side effects where the patient will have delayed ejaculation or delayed orgasm. two drugs which have the problem of discontinuation syndrome, that is paroxetine and fluvoxamine, right? Okay, now the second class of drug is SNRI. The medicines are SNRI. Now SNRI full form is serotonin noradrenaline reuptake inhibitor. Serotonin noradrenaline reuptake inhibitor. So medicines are serotonin noradrenaline reuptake inhibitor. So SNRI. Medicines are duloxetine, milnacipran and venlafaxine. Three medicines are there: duloxetine, milnacipran and venlafaxine. And we made a mnemonic during our lecture कि when दूल्हा मिलेगा. So it's a Hindi mnemonic again. So when दूल्हा मिलेगा or when दुल्हन मिलेगी, whatever you want to say. So when is the English word. Dula Dulan is groom and the bride, right, guys, who is from South India. So Dula means the groom and the Dulan means the bride, right? So Milega means when they will find it. So when Dula and Dulan Milega. So Venlafaxine is for when, and Dula Dulan is for duloxetine, and Milnacipran is for Milna. Three medicine: Venlafaxine, duloxetine, Milnacipran. These medicines are SNRI. Now, what are the indications of drugs? So these medicines have same indications as SSRIs. These medicines have same indications as SSRIs, but not useful for premature ejaculation. So medicines have same indications like 3 neurotic disorder, 1 problem of young female, 1 problem of old female, 5. But medicines have no role in premature ejaculations. Medicines are not approved for premature ejaculation, right? So drugs are not given for premature ejaculation. Now apart from that, the duloxetine drug, the drug which is duloxetine, which is also given for the treatment of stress incontinence and also used for diabetic neuropathy. So medicine is given for diabetic neuropathy, and these days the drug is given as first line drug again. So this medicine along with pregabalin and gabapentin. So duloxetine is a medicine which belongs to this class. This medicine is drug of choice for stress incontinence, and these days duloxetine is also given as first line drug for diabetic neuropathy. So diabetic neuropathy, in antiepileptic we discussed that pregabalin and gabapentin are used. So pregabalin, gabapentin are used, but if the patient is having the symptoms of depression, we can also use duloxetine. So in patients who have symptoms of depression, we can also use duloxetine in that patient. So nowadays duloxetine is used as a first line drug for neuropathy, diabetic neuropathy also, and also given for stress incontinence. Now these SNRIs are avoided in pregnancy, and side effects of SNRIs we did not discuss in our lecture because that is out of scope for your exam point of view. Although these medicines will cause side effect, but we did not discuss because it is not required. Now the third topic is tricyclic antidepressants. Now tricyclic antidepressants are the medicines which can increase both noradrenaline as well as serotonin. Will increase both noradrenaline as well as serotonin, and the medicines are tricyclic antidepressants, so they have the word tri in their name. These medicines have the word tri in their name, like amitriptyline and nortriptyline. One outdated drug is imipramine, so mainly we use this medicine these days, that is nortriptyline. So nortriptyline is a drug which has minimum side effect out of all. So this medicine is the one which we use nowadays for most of the conditions. So nortriptyline has minimum side effect which we use nowadays. Now what are the indications of drugs? So medicines have same indications as SSRIs or SNRIs, but these drugs are drug of choice for post-herpetic neuralgia. Medicines are drug of choice for post-herpetic neuralgia. The drug is nortriptyline. Now these medicines are also safe to use in pregnancy like SSRIs. So SSRIs are safe, TCA are safe, but SNRIs drugs are avoided in pregnancy. Now what are the side effects of this medicine? Now the medicine side effects are like antipsychotic drugs. Medicine side effects are like antipsychotic drugs. So just like antipsychotic drugs, these medicines will also cause same side effects like blocker of histamine receptor, alpha-1 receptor, muscarinic receptor, and medicine will also cause QT prolongation and seizures and sexual dysfunction. So you must have covered the atypical antipsychotic. We discussed the mnemonic MADS headquarter. Now out of that MADS headquarter, just make a mnemonic SAM headquarter. So D word is removed. Medicines will block muscarinic, alpha receptor, histamine receptor, seizure, sexual dysfunction, and QT prolongation. But there is one different drug here, amoxapine. Amoxapine is the drug here which will also block the dopamine pathway. And by blocking the dopamine pathway, this medicine can cause extrapyramidal symptom and hyperprolactinemia. Now, toxicity of TCA drug is important, and the drug of choice or the antidote of choice for TCA toxicity is sodium bicarbonate. So, during toxicity, patient develops metabolic acidosis, and due to this metabolic acidosis, patient can die. So, the antidote of choice is the one that will control the patient acidosis. So, sodium bicarbonate is the best medicine for TCA poisoning. This is what we have discussed under typical antidepressant drugs. After that, we discuss some atypical antidepressant drugs. So the medicines names are trazodone. And for trazodone, which is an atypical antidepressant, we discuss that the medicine is also given for the treatment of erectile dysfunction. So we made a mnemonic that trazodone is a drug. When given to a patient, the drug will cause erection. And once you have the erection, you can hang the tarazu on that. So tarazu is a balance. You can hang that tarazu on the penis, the erected penis. So medicine trazodone is given for treatment of erectile dysfunction. The second drug which we discussed here was bupropion, and in bupropion we discussed a mnemonic that if you want to be a proper person in your life, prop means if you want to be a proper person in your life, so please quit the smoking. So this medicine is given for smoking cessation. We discussed that if you want to be a proper person in your life, so prop is for proper. If you want to be a proper person in your life, then quit the smoking. But this drug is not used nowadays. The problem is the drug can cause seizures. The important side effect of this medicine is seizure. That's why this drug is less commonly used nowadays. The third medicine which we discussed here was atomoxetine. So we discussed that atomoxetine is a medicine which starts with alphabet A and T. And because this medicine starts with alphabet A and T, apart from depression, this medicine is also given for ADHD, that is attention deficit hyperactive disorder. So attention deficit word also starts with A and T. Attention word also stands for A and T. So this drug is given for attention deficit hyperactive disorder, that is atomoxetine. The fourth drug which we discussed here was mirtazapine, and we discussed that mirtazapine is a drug which is given for the treatment of depression with insomnia. So we use this medicine for the treatment of depression with insomnia. So the drug is mirtazapine. That is all about antidepressant medicines that we discussed. Now after this antidepressant topic, we discussed about the anti-anxiety drugs. So the medicines which are used as an anti-anxiety drugs. Now anti-anxiety drugs, we discussed that there are three group of medicines which we use as anti-anxiety. So first is benzodiazepines. So benzodiazepines, they are the drug of choice for acute attack of anxiety. These medicines are drug of choice for acute attack of anxiety. Now, apart from that, we have some medicines which can increase the level of serotonin, and these medicines are like SSRI. One more group is SNRI. Now these medicines are used as a drug of choice for maintenance treatments. So drugs which can increase serotonin. So serotonin is a chemical which gives you the motivation and that will relieve your anxiety. So SSRIs and SNRIs given for maintenance treatment, but benzodiazepines are given for acute attack of anxiety. Now we have a drug over here. The drug name is buspirone. Now buspirone is a drug. This is given only for one type of anxiety disorder. We call it generalized anxiety disorder. So buspirone is a drug that is given for generalized anxiety disorder. So we made a mnemonic: whenever the bus will come, your anxiety is gone. Whenever the bus comes, the anxiety is gone. So bus is related with your relieving of the anxiety. So buspirone is given for generalized anxiety disorder. The medicines are known as anti-anxiety drugs. Now after anxiety drugs, we discuss the topic of bipolar disorder. The drugs which are given for bipolar disorder. So the medicines which are given for bipolar disorder. So which medicines we use for bipolar disorder? The medicines are known as mood stabilizers. The drugs are known as mood stabilizers which are given for bipolar disorder. Right? So patients who have come to you with bipolar disorder, these patients can come to you with acute attack of bipolar disorder, or patient can come to you for maintenance treatment of bipolar disorder. So patient of bipolar disorder can come to you for acute attack treatment, or patient can come to you for maintenance treatment. And for maintenance treatment, because that lithium is overall drug of choice, but the second drug of choice is atypical antipsychotics. So lithium is the best medicine for maintenance treatment. It is the only drug here. This is the only drug here which can reduce suicides in bipolar disorder. It is the only drug here which can reduce suicides in bipolar disorder. So lithium is the best medicine for bipolar disorder. The second best medicine is atypical antipsychotic drugs. So atypical antipsychotic, second best, the best is lithium. But there is one exception to the rule. The exception is pregnant female. So in pregnant female, please remember, atypical antipsychotics are better than the lithium. Atypical antipsychotics are preferred in pregnant female than the lithium, because lithium is a drug when given to pregnant female, the baby can be born with one anomaly. The anomaly is known as Epstein's anomaly. So baby can born with Epstein's anomaly, which is the anomaly of right side of the heart. So lithium is a medicine when given to pregnant female, there is a risk of Epstein's anomaly, but still we give, like it's a second drug of choice in pregnancy. The first drug of choice in pregnancy is atypical antipsychotic. Lithium is a second drug of choice for bipolar disorder in pregnancy, right? Because it's the only drug which can control suicide. Now if you're a pregnant female who is suffering from bipolar disorder, and if she has a tendency to commit suicide, then obviously lithium should not be stopped. Lithium should be continued. Now for acute attack of bipolar disorder, if the patient has come to you with acute mania, you will give sodium valproate or lithium. Along with that, you will give atypical antipsychotics. So you will give two medicines together. So sodium valproate is a better along with atypical antipsychotic, or if sodium valproate is not given in MCQ, you can go for lithium with atypical antipsychotic. If the patient has come to you with acute hypomania, you will only give atypical antipsychotic. The high efficiency drugs like lithium and valproate are not required. Number 3, if the patient has come to you with acute depression, then you will give combination of SSRI with atypical antipsychotics. So you will give combination of SSRI with atypical antipsychotic drugs. So SSRIs with atypical antipsychotics we give for acute depression. So SSRIs given along with atypical antipsychotics for acute depression. Hypomania, we give only atypical antipsychotic. For acute mania, we give sodium valproate plus atypical antipsychotic. Now regarding lithium, we discussed few points. That lithium is a drug which is a narrow therapeutic index drug. We discussed that lithium is a drug which has narrow therapeutic index drugs and always given with plasma concentration monitoring. So this medicine is always given with plasma concentration monitoring, and the drug level in plasma should always lie between 0.5 to 1.5 milliequivalent per liter. So lithium is a narrow therapeutic index drugs, and its plasma concentration monitoring is always required, and the drug level should always lie between 0.5 to 1.5 milliequivalent per liter. Next is, please remember, body cannot differentiate between lithium ion and the sodium ion. So body cannot differentiate between lithium ion and the sodium ion. Number 3 point we have discussed, what is the treatment of choice for lithium toxicity? The answer is hemodialysis. So hemodialysis is treatment of choice for lithium toxicity. This is what we have discussed. And number 4, we have discussed the half-life of lithium is approximately 24 hours. Now these are the 4 MCQs basically. The half-life of lithium 24 hours. Body cannot differentiate between lithium ion and the sodium ion. The treatment of choice for lithium toxicity is hemodialysis, and lithium is a narrow therapeutic index drugs which required clinical monitoring always. After that, we discuss side effects of lithium. And what are the side effects of lithium? So in lithium side effects, we have discussed that this medicine can increase the leukocyte count. So medicine can increase the WBC as a side effect. Number two, this medicine can cause tremors as the most common side effect. Medicine can cause tremors as the most common side effect and also cause inversion of T wave in ECG. This medicine can cause inversion of T wave in ECG. So drug will cause tremors, drug will cause inversion of T wave in ECG. The drug will also cause hypothyroidism. So this medicine can cause hypothyroidism as a side effect. This medicine will cause increased urination. Drug will result in increased urination or increased urine as a side effect, which is also known as diabetes insipidus. Also known as diabetes insipidus, increased urination. And this medicine, when given to mother means the pregnant female. So when this medicine is given to pregnant female or the mother, the baby is having the Epstein's anomaly. So increased leukocyte is from Li. T stands for tremors and T wave inversion. H stands for hypothyroidism. IU stands for increased urination, and M is for mother. When given to mother, this will cause Epstein's anomaly. So this is all about the psychiatry part, which we have covered during our lecture. After that, we discussed our topic of opioids here. So we discussed our topic of opioids, if you remember. So in opioids, we have discussed the medicines which are full agonist. We have discussed 4 types of medicines. The first is full agonist of mu receptor. So the medicines which will act on mu receptor, we call them full agonist of mu receptor. So we have 4 types of medicines: full agonist, partial agonist, antagonist, and medicines which have mixed action. So full agonist, partial agonist, antagonist, and the medicines which have mixed action. So the drugs which have full agonist, the drug is morphine. The first drug is morphine. So morphine is full agonist of mu receptor. It's the second most potent opioid available in the market. It's the second most potent opioid available in the market. And this medicine is used as a painkiller, as well as this medicine is used for CHF, we discussed already. So drug is used as a painkiller as well as given for CHF. Number 2 drug, which is full agonist of receptor. Medicine which is used as a full agonist of receptor, the drug name is methadone. Now methadone is a drug which is used as a drug of choice for opioid de-addiction. This drug is used as a drug of choice for opioid de-addiction. Number 3 drug which is full agonist, the drug name is meperidine. The medicine name is meperidine. Now meperidine is having the word dine, so the other name of this medicine is pethidine. Other name of this medicine is pethidine. Now meperidine is used as a painkiller, and also this is drug of choice for post-operative shivering. This medicine is drug of choice for post-operative shivering. The drug is meperidine. So all these 3 medicines starts with M, and all these 3 medicines will act on mu receptor. So mu also starts from M. Mu also starts from M, that is morphine, methadone, and meperidine. Now apart from that, we have some other drugs also. The drugs which are having the word fentanyl in their name. So drugs are sufentanil, medicine is remifentanil, one more drug is L-fentanyl. So these medicines which are having the word fentanyl in their name, all these medicines are used as a painkiller. So they are given for post-operative pain. So these medicines are used for the post-operative pain, right? Now please remember, the sufentanil is the most potent medicine out of all. These medicines, sufentanil is the most potent opioid out of all. And we have one more drug which is agonist, that is loperamide. It's a drug of choice for non-infective diarrhea. So medicine is drug of choice for non-infective diarrhea because medicine can reduce the peristalsis. So which drugs are agonist? The medicines which are agonist, they start from alphabet M. That's why they will act on mu receptor, plus the medicines which are having the word fentanyl in their name, and also the loperamide, which is given for non-infective diarrhea. Partial agonist. The medicines which are partial agonist of mu receptor. Medicines which are partial agonist of mu receptor. Now these medicines are total 2. One is known as buprenorphine, and the second drug was codeine. One was buprenorphine, second was codeine. Now codeine is given for cough. So we discussed the mnemonic CO is for CO, cough, and buprenorphine is a drug which is a drug of choice for opioid de-addiction. So along with methadone, this is also used as first line drug for opioid de-addiction. So two medicines given for opioid addiction. One is this methadone and the second is this buprenorphine, which is given for opioid de-addiction. The third topic is opioid antagonist. The medicines which are opioid antagonist. Now these medicines are blocker of mu receptor. Now again these medicines are total two. One is known as naloxone. One drug is known as naloxone, which has the fast onset of action, and second drug is naltrexone. Second drug is naltrexone, which has slow onset of action. Now the drug which has fast onset of action, this is drug of choice for opioid toxicity. So this medicine is drug of choice for opioid toxicity. And the drug which is naltrexone, now this medicine is drug of choice to prevent relapse. This drug is drug of choice to prevent relapse in case of opioid as well as in case of alcohol. So this medicine is given to prevent relapse in case of opioid as well as alcohol. Also, this is considered as drug of choice for alcohol de-addiction. This is drug of choice for alcohol de-addiction. So please remember, for alcohol de-addiction, we don't have much option, so we always give naltrexone. So naltrexone is given for alcohol de-addiction, and naltrexone is also given to prevent relapse in case of opioid as well as alcohol. Now we have the fourth group of medicine. We have the fourth group of medicines which have the mixed action. So the medicines which have mixed action drugs. So the mixed action drugs are again two. Now these medicines are tramadol. The drug is tramadol and the second drug is dextromethorphan. So second drug is dextromethorphan. Now dextromethorphan is a drug. This medicine is drug of choice for dry cough. This medicine is drug of choice for dry cough, and tramadol is a drug which can increase the level of noradrenaline and can cause tachycardia as a side effect. So tramadol is a drug which can cause tachycardia as a side effect. So these drugs are opioids. Now apart from that, there are some other MCQs which are based on opioids, like if the patient is having CKD. If the patient is having CKD, there are two medicines which are contraindicated, that is morphine and pethidine. So morphine and pethidine are contraindicated in CKD. So students make the mnemonic that morphine and pethidine will make the CKD more pathetic, right? So more pathetic. So these two medicines, which are morphine, second is pethidine, will make the CKD more pathetic. So morphine and pethidine should not be given in CKD patients. Otherwise, these medicines will cause seizures as a side effect. These medicines will cause seizures as a side effect. The second is tolerance. So whenever we give opioids, patient will develop tolerance to the all actions. Patient will develop tolerance to the all actions of opioids. So whenever you give opioids, patient body become tolerant to all actions, but not to the constipation. So tolerance is not seen for constipation, tolerance is not seen for convulsions, and tolerance is not seen for constriction of pupil. It is not seen for constriction of pupil, that is meiosis. So opioids can cause meiosis, and tolerance is not seen for meiosis, convulsions and constipation. Otherwise, tolerance is seen against all actions of opioids. So tolerance is seen against all actions of opioids, right? Dr. Pethidine means meperidine, right? So these are the things which we have covered in topic of opioids. Now apart from that, one is drug de-addiction topic. So one topic we have discussed is drug de-addiction, and in this topic of drug de-addiction, there are three medicines which are abusive drugs. One is opioid, second is alcohol, third is nicotine. So opioid drug de-addiction, alcohol de-addiction, nicotine de-addiction. Now whenever the patient has come to you in OPD for de-addiction and cravings, that methadone and buprenorphine, Methadone and buprenorphine are two medicines which we use for opioid de-addiction and cravings. But for alcohol, we don't have much option, so we use naltrexone as a drug of choice. One more drug is acamprosate, which we can use. So acamprosate and naltrexone are two medicines which we use for alcohol de-addiction. Now for nicotine de-addiction, we can use nicotine replacement therapy. We can use nicotine replacement therapy as a treatment of choice. And we can also, nicotine replacement therapy is given in the form of skin patch. We can also use this medicine. The drug name is varenicline. Now varenicline is a drug which is having the word NIC, So this is a nicotine receptor agonist. It's a partial agonist of nicotine and receptor, used as a second drug of choice for nicotine de-addiction. If you want to be a proper person in your life, quit the smoking, but the side effect is seizures. Now we have opioid withdrawal, alcohol withdrawal, and nicotine withdrawal. Now for opioid withdrawal, we will give the same medications like methadone and buprenorphine, but for alcohol withdrawal, we use a medicine that is chlorinated diazepam. So chlorine plus diazepam analog. So medicine which is chlorine plus diazepam to make your plasma pure. But if there is a presence of delirium tremens, which is also known as complicated alcohol withdrawal. So this is known as complicated alcohol withdrawal, because sometimes in MCQ, they will not mention that patient is having delirium tremens. They only give you what is a drug of choice for complicated alcohol withdrawal. So for complicated alcohol withdrawal, we give lorazepam and diazepam. So we give lorazepam and diazepam for complicated alcohol withdrawal. Now for nicotine withdrawal, generally we don't give medicines, but if you need to give some medicines, we can give nicotine itself as a drug. So for nicotine withdrawal, when the patient has withdrawal of something, give the same thing to the patient. So give nicotine in the form of gums and nasal spray. Now prevention of relapse. Now whenever patient has quit taking the drug, patient has given up the habit of taking an abusive drug, now there is a possibility that patient will again come to you with re-intake of drug. So that is known as relapse. So patient can come to you with re-intake of drug, that is known as relapse. So naltrexone is given as a best medicine to prevent relapse in case of opioid as well as in case of alcohol. But disulfiram is one drug which we can use also for alcohol relapse, prevention of alcohol relapse. Disulfiram is inhibitor of aldehyde dehydrogenase enzyme. Now for toxicity treatment, for opioid toxicity, we will use a fast-acting medicine, fast-acting antidote naloxone. But for alcohol toxicity, we don't have any antidote, so we give the symptomatic treatment. But if there is presence of psychotic symptom, alcohol toxicity, patient is having psychotic symptoms, like patient has got Wernicke's encephalopathy or Korsakoff psychosis, then we can try to give vitamin B1 or thiamine as one of the drug, right? And for nicotine toxicity, which is very, very rare, we give symptomatic treatment. Right? So symptomatic treatment is for that. So this topic is over. Next topic is hematology. So we talk about this topic, hematology, and here again all topics can be asked. So all topics are important in hematology, and minimum 2 MCQs will be asked. Minimum 2 MCQs will be asked from this hematology topic. Right? So the first topic is antiplatelet drugs. Now antiplatelet drugs are mainly given to patients who have problem in their arteries. So medicines are given for the treatment of angina, ST elevated MI, stroke and gangrene. So whenever the patient is having obstruction in arteries like angina, ST elevated MI, stroke and gangrene, we give antiplatelet drugs. Now which drugs are antiplatelet drugs? We can have aspirin. 4 medicines are there which we use. Number 1 is aspirin. Second drug is clopidogrel. Third drug is apixaban, and the fourth drug is dipyridamole. So these are the 4 drugs which are antiplatelet. Now out of these 4, aspirin is used in a dose, low dose, that is low dose is 75 milligram to 325 milligram. So in this low dose, this medicine is used as an antiplatelet drug, and this is irreversible inhibitor of COX-1 enzyme. In this low dose, this medicine is irreversible inhibitor of COX-1 enzyme, and inhibit thromboxane synthesis and follow hit and run phenomena. So this medicine follows hit and run phenomena by inhibiting COX-1 enzyme irreversibly and therefore reduce the level of thromboxane E2 synthesis. Now aspirin is given for all these four indications like angina, MI, stroke and gangrene, but it is also given as drug of choice to prevent preeclampsia. So to prevent preeclampsia, aspirin is given as one of the drug in foreign countries. This is not commonly used in India. Now we have some other drugs like tick sugar dog. So tick stands for ticlopidine, second tick stands for ticagrelor, dog stands for clopidogrel. So ticlopidine, ticagrelor, clopidogrel and prasugrel. Sugar stands for prasugrel. These are the four medicines. Tick sugar dog, right? These are the four medicines which are inhibitor of ADP receptor. The name of the ADP receptor is P2Y12 receptor. The name of the ADP receptor is P2Y12 receptor, which is blocked by these medicines and used as an antiplatelet. For efiximab, it is glycoprotein 2,3 inhibitor. We made a mnemonic, that is ABC. You write down the ABC, then write 1, 2, 3. So 1 stands for this drug is given by IV route. This drug is given by IV route and it is inhibitor of glycoprotein 2,3. So medicine is inhibitor of glycoprotein 2,3 and given by IV route. The drug name is efiximab. The last drug is dipyridamole, which is phosphodiesterase enzyme inhibitor, and the important side effect of this medicine is coronary steal phenomena. Important side effect of this medicine is coronary steal phenomena. Right? The drug is dipyridamole. Whenever patient has to undergo surgery, if the patient has to undergo surgery, so before the surgery, aspirin need not to stop, continue the aspirin. But clopidogrel, ticlopidine and prasugrel are three medicines that need to be stopped 4 to 5 days before surgery. So clopidogrel, ticlopidine, prasugrel need to be stopped 4 to 5 days before surgery. That is all about this topic, anticoagulants. So anticoagulants are aspirin, COX-1 inhibitor, clopidogrel, P2Y12 inhibitor, efiximab, glycoprotein 2B3A inhibitor, and dipyridamole, phosphodiesterase inhibitor. And dipyridamole side effect is coronary steal phenomena. A boy or a girl with a mole will steal your heart, that is coronary steal phenomena. Now we have next topic, anticoagulant drugs. Now anticoagulant are the medicines which are given to block the clotting factor pathway. Now these medicines are given to block the clotting factor pathway. So medicines are known as anticoagulants. Now these drugs are two types, directly acting and indirectly acting medicines. Now the medicines which are directly acting, now these drugs are inhibitor of factor 10A or factor 2A. So directly acting medicines are inhibitor of factor 10A or factor 2A. So the medicines which are direct factor 10A inhibitors, these medicines are always given by oral route. These medicines are always given by oral route. So we call them DOAC. We also call them DOAC, that is directly acting oral anticoagulants. So we call them directly acting oral anticoagulants given by oral route, and all these medicines are having the word XA ban in their name. So these medicines will ban factor 10A. So medicines are known as apixaban, rivaroxaban. All these medicines are there which are factor 10A inhibitor given by oral route. Now we have some medicines which are factor 2 inhibitors. Now factor 2A is known as thrombin. So medicines are known as DTIs, direct thrombin inhibitors. Now these medicines are given by IV route. The drugs are ergotroban and bivalirudin. But there is one drug that is given by oral route, and this is very important question. Dabigatran is a drug which is given by oral route. Now two of these medicines are having the word bi in their name. So bivalirudin is having the bi and dabigatran is also having the word bi. So bi means 2, so these medicines are factor 2 inhibitor. Now ergotroban is a drug which is having the word thrombin ban. So these medicines are having the word thrombin ban. Thrombin is the name of a factor 2, so it's a thrombin ban drug. The drug name is ergotroban. Now we have some indirectly acting medicines. Indirectly acting medicines are low molecular weight heparin. Now low molecular weight heparin are those drugs which always end up with the word parin. Always end up with the word parin. The drug is enoxaparin and dalteparin. So drug is enoxaparin and dalteparin. So these medicines are low molecular weight heparin. And the second drug which is indirectly acting is warfarin. Now warfarin has one very big advantage, that this medicine is given only by oral route, and if you give it by oral route, the absorption is very good. But heparin has this drawback. This medicine cannot be given by oral route. So this drug is always given by IV route and subcutaneous route. So low molecular weight heparin always given by IV and subcutaneous route, but warfarin is a drug that is always given by oral route. Now heparin is a drug which is safe in pregnancy. Heparin is a medicine which is safe to use in pregnancy, but warfarin is a drug that is unsafe in pregnancy. When given to pregnant female, the baby will develop Contradi syndrome, where the baby chondrocytes will not develop and baby become dwarf. If the baby mother has taken warf, baby will become dwarf. Now, the biggest advantage of using heparin is this medicine has fast onset of action and fast offset of action. Now, because of the fast onset of action, this medicine can be given for acute emergency. So, medicine can be given for acute emergency, and because of fast onset of action, this medicine is stopped one day before surgery. Medicine is stopped one day before surgery, and medicine is given for acute emergency treatment.